All right. Hello and welcome to my Florida Medicare 101 webinar. I am your host, Chaz Mulheron. It's now Thursday. What is the date today? December 12th. It's 11 a.m. I thank you guys for attending here live. If you're watching this recorded on my YouTube channel and you finish this webinar, you can go ahead and you will see my email and my phone number in the description. For the rest of you that are here live today, at any time, whenever you exit this webinar, you will see a survey pop up, and I can reach out to you by email. I can send you all the Medicare numbers we're going to go over today, all the costs for 2025. And then you can also schedule a phone call if you'd like to as well. For most of you, this is probably your first time at a Medicare workshop or webinar here. My goal today is just to give you a better understanding of Medicare and then the options that are going to be available to you once you do go on to Medicare. This event should last about 1 hour. If you have any questions, feel free to use the chat function on my area. It shows up top over there, but you can use the chat function. I'll answer any questions you might have, but a lot of times I'll answer those questions in the following slide or a slide later on. If you want to take notes, you can, but you will notice, let me put this up. I just mentioned about all the Medicare costs. I can send you the 2025, every cost that I'm going to go over today. So if you want to take notes, you can, but I'll send you this by email as well. So you guys have all the 2025 numbers. And then if you fill out my survey where I get your email address, again, I'm not going to bombard you with emails, but you will get my Medicare 101 my Medicare, everything you know about Medicare booklet as well. This is about 12 pages. It talks about parts A, B, C, and D, and supplement plans, how they work and everything. So I can send you that as well. All right, let's go ahead and begin. Let me get back to the workshop. The first thing I have to mention, the disclaimer, this event is for educational purposes only. No plan-specific benefits can be or will be shared. What do I mean by that? Well, if you were to message and say, Chaz, hey, I want to know what that Humana plan is doing next year. What's the copays? I can't go over all that. There's about 60, 70 plans in any given, county. It would just take too long. And plus, because I registered this with the Department of Insurance, CMS, as educational, this is all educational. I can't talk about plan details. If you want to schedule a phone call and actually talk about plans in your area, that would have to be after this webinar. I do not work for the government. I am licensed with the state of Florida and contracted with each company in Florida, but I do not work for the government. I'm an independent broker. You never pay me anything. Don't ever worry about that. All right, who are we? My company is Mulheron Insurance Services. I'm located in the Orlando area. Maitland is my office, and I live in Oakland, Florida, which you might not have heard of. Oakland, it's pretty small, but Winter Garden, Florida, and I drive over to Maitland for my office. I do educational courses online so that you guys that might not be in Orlando area can watch the same thing that I do in person at the library. So I do both online and in person. That's me there. This is kind of like my little business card, Chaz Mulheron, but Chaz is not my real name. Most people that are named Chaz probably weren't born Chaz. My parents, when I was born, I'm Charles Stephen Mulheron III. They called me Chaz since I was born. So if you do look up my license on the Department of Florida, you'll see Charles Mulheron listed there. You got my email address. So if you need to email me, I've had that email for a very long time. I've had my cell phone number even longer. I've had that since 1997. That's the only phone number I have. If you get some kind of like text message, it's just more of like you might have received one of, hey, a reminder about this webinar. That's not my cell phone number. That's just like an automated, system. So you can't reply to that. The only number I use is that number right there. So go ahead and jot that down if you need to, do a screenshot. But again, you'll get my email as well with all my contact information on there. Okay, what are we going to talk about today? Well, we're definitely going to talk about your original Medicare, your Part A hospital, and your Part B medical. We'll talk about optional supplement plans or Medigap plans to cover your Part A and Part B. We'll talk about drug coverage, which is your Part D. We'll talk about Part C, Medicare Advantage plans. I'm sure you guys have been seeing lots of commercials for the last couple of months about these Medicare Advantage plans. What are they? What are the pros and cons? I will talk about that in a little bit. I'll also talk about how do you enroll in Medicare? Should you enroll in Medicare? Are there any penalties if you don't? And what do you do if you're still working? Hey, I have coverage from my employer, Chaz. Do I have to take Medicare? I'll talk about that as well. All right, Medicare versus Medicaid. You guys are here today because you want to learn about Medicare. You typically age into Medicare at age 65. I'm sure you guys probably know that. But then you might say, well, how do I have a neighbor or a friend? They got on Medicare before 65. Well, most likely, if they got on Medicare early, it was because of a certain disability they got. After 2 years, you can get Medicare at that point. Now, Medicaid is different. Medicaid is based off of your income and your assets. So not everybody will get Medicaid. In fact, most people will not qualify for Medicaid. So it's made for people who have limited income and limited assets. And then the state comes in and pays their Medicare costs. You know, I've talked to people where maybe their Social Security is only $800 a month and they're not working. They don't have any other income. They're single and they don't really have any assets. Well, it's not fair for them to have to pay the Medicare premium. They can't afford it. So the state will step in and cover their Medicare costs. I don't have those numbers today because they're being updated probably here soon. But if you think you might qualify for Medicaid, please let me know whenever we talk on the phone. If you do get Medicare and Medicaid, you're considered dual eligible. You got both. All right. Original Medicare. That's the Part A and Part B. You might not know, but Part A and Part B of Medicare started back in 1965. So it's been out there for, 59 years, I think. And it's been the same for that long. Part A and Part B, that's just original Medicare. Now you might say, well, I've heard of these other plans. Yeah, there are other options out there, but you don't have to do those advantage plans, those supplement plans, the drug coverage. You're not forced to do it. You can just have your original Medicare A and B. Now, you might not take Medicare A and B when you're first eligible, but eventually you're going to have A and B. I want to make sure you guys know what this A and B, let me show you the Medicare card, what it's going to look like. There it is. That's what your Medicare card is going to look like. It's going to have your first and last name, middle initial, if you have one. And they no longer use your Social Security number as your Medicare number, but you will have a random generated Medicare number, which is made up of 11 characters, numbers, and letters. Then you're going to see on there hospital Part A with your effective date, medical Part B. That's been the same since, like I said, 1965. When you get this Medicare card, you don't have to do anything else. It's optional. So let me tell you what this card will do for you for Part A and Part B. That's what we want to know. Let me get my little pen drawing up here. Let's use red. Okay. So like I mentioned before in the opening of this webinar, this is now updated for 2025. That's why I wanted to record today. Like I said, it's December 12th. I had one on Tuesday, but that was my first one in a couple of months. But this was the first one where I felt ready to go for 2025 information. So all updated for next year. So we're good to go now for the whole year. So let's talk about your Part A hospital. If you would have noticed on that Medicare card that I just showed you, I think it said 3/1/2016. Part A is your hospital. It only starts on the first day of the month. You will never see Part A of Medicare start on the 10th, the 15th, the 30th. Now, I can't see you guys here. We're not in a library like I sometimes do library seminars. But if we were, I would have picked somebody out in the room and say, hey, Debbie, what's your birthday? So we'll go ahead and use myself as my birthday. My birthday is coming up here January 27th, next month. So let's use an example that my birthday was January 27th, 1960. That would mean that this January, I would be turning 65, right? Even though my birthday's at the end of the month, January 27th, Part A would start on January 1st. So A will always start on the first day of your birth month, unless you're born on the first. If you're born on the first of the month, you get it a month early. Okay. So we know Part A is your hospital. Most people that have Part A won't pay for it. I already know I have my 40 quarters that I've worked paying into Medicare. When you get a pay stub or even if you just pay taxes, every 3 months that you pay into Medicare, you have that Medicare deduction. That is a quarter. Another 3 months, that's another quarter. If you get 40 quarters, doesn't have to be consecutive. You can get one quarter and not work for a year and get another quarter. It doesn't have to be consecutive. But if you accumulate 40 quarters or 10 years, your Part A is free. Most people will have free Part A. Now, if you did not have 40 quarters, there could be a premium for Part A as high as $518 a month. But if you're ever married to somebody now or in the past that paid into Medicare for 40 quarters, you can collect Medicare from them as well. So you qualify, because it might not be right if maybe you didn't work, but your spouse did, so you want to get Medicare from them. So hopefully your Part A is free. Like I said, most people, Part A is zero. So we know that Part A is zero, but we want to know, what does that hospital do, Chaz? A hospitalization covered, okay? So like I said, my Medicare would start on January 1st. So let's say that's the same for you. Let's say your birth date happened to be January 27th as well, and your Medicare Part A started on January 1st. Well, on January 10th, let's say you call me up and say, Chaz, I attended your webinar back in December or maybe earlier last year, and I do not remember what you said, but I just left the hospital. What's that going to cost me? I don't remember. Well, my first question to you is, what do you mean by hospital? Were you admitted to the hospital? Or did you just go into the hospital, the emergency room, and leave after a couple of hours? And you say, no, Chaz, I was admitted. I was there January 1st through January 6th. I'm going to say, okay, good, because you were hospitalized. Now that I know that Medicare Part A will kick in, and you'll get at least a semi-private room. You'll get your meals covered, general nursing, hospital services and supplies, and it's going to cover all but the first 3 pints of blood. And you say, great, Chaz, you're taking Medicare is going to pay for all of my hospitalization stay. Well, not quite. They're going to cover your hospital stay, but they're not going to cover it in full. So now we go on the right-hand side over here, and you're going to see some gaps in Medicare. Gaps in Medicare are in light blue, and it's what you owe. Okay, so anything in light blue on the right-hand side is what you would owe for this hospital stay. Medicare will cover all but that amount. So you say, Chaz, I saw that hospital bill, and man, it was $50,000. What do I have to pay? Well, days 1 through 60, you're going to owe $1,676. Now, this is your room and board, the nurses, the hospital stay. It doesn't include the surgery, but it does cover your hospital stay for the first 60 days, and you would owe $1,676. So you said you were in there from January 1st through January 6th. On January 6th, when you leave the hospital, you have 60 days from that date to be readmitted. So I'm going to keep the numbers easy. I'd say February 6th, March 6th. I know it's not exact, but after 60 days, or within that 60 days, within March 6th, if you get hospitalized, you're still covered because you paid that $1,676. Now, if that benefit period ends, you go in maybe 3 months later and the benefit period ends and you go back into the hospital, it starts a new benefit period. And now you owe another $1,676 for that hospital stay. Now, the less uncommon is if you stay longer, but Medicare is pretty much saying the longer you stay in here, the less Medicare is going to pay and the more you're going to pay. So days 61 through 90, you're going to owe $419 every single day that you're in there. If you stay even longer, it's double, $838 a day. That's days 91 through 150. The government says, look, these are your lifetime reserve days. If you use days 91, 92, 93, and you go out of the hospital, well, you just used 3 days of your lifetime reserve days. And now you only have, 57 days left in there. You can always go back to day 1, but days 91 through 150, you only get those once per lifetime. Anything beyond 150 days in the hospital consecutively, you're on your own. Medicare will not pay that. Now, Medicaid might step in. Maybe the hospital writes it off. They know they're not going to get their money, but if you have assets, they're going to come for that first. But Medicare will not cover you beyond 150 days. Remember, they won't cover the first 3 pints of blood either. And Medicare won't cover comfort or convenience items. It's weird. I think I had somebody one time need like a heating pad or something, and Medicare doesn't cover that. So very odd on some things you might see there that they don't cover. So anything in top there in the light blue is a gap in Medicare. Now this call I get often, I'd say once a month now at this point. I've been doing this for 16 years almost. February will be 16 years. So now I have so many clients that are, using me as their, any questions they might have. And they call me and say, Chaz, hey, I just got hospitalized. And I kind of know where the question's going. Or maybe my spouse just got hospitalized. But they're saying, I'm not going to be in the hospital bed anymore. They're going to move me to another wing of the hospital. Or maybe they're moving you to a facility, a different facility. What is this going to cost me? Well, Medicare says if you spend at least 3 days in the hospital, Medicare will cover skilled nursing care. Think of inpatient rehab, not outpatient, inpatient rehab. Because remember, Part A, you must be admitted. Everything is you're admitted. Medicare says we will cover the first 20 days. And people always tell me, oh, yeah, I heard that they said they're going to get me out within 3 weeks. And they will try to, for sure, within 3 weeks. You got to show progress that you're getting better. I did have somebody, I think it was in October or so, he did say 38 days in skilled nursing care. So if that were to happen to you, on day 21, you would start owing $209.50 next year for every day that you're in there. Medicare will allow you to stay in there and pay it up to days 100, assuming you still need it. But after day 100, Medicare says we're out, we're bowing out. We're not going to cover long-term care. So Medicare doesn't cover that. Hopefully you have some kind of long-term care policy, or maybe you have some savings, you can pay for it. If you don't have either one of those and you don't have any assets or savings to pay for it, Medicaid would step in to cover a long-term care facility, but Medicare will not. Okay, any questions about Part A? Please let me know before we move on. We're gonna move on to Part B here, but you can let me know still. Okay, let's talk about Part B of Medicare, again, 2025. Now, Part B, like Part A, can only start on the first day of the month. So I'm gonna give you two scenarios here. One, I take Part B because I'm eligible. Remember, I said my birth date is January 27th. Let's say it was 1960. If I want to take Part B, it will start on January 1st. But it's optional. I don't have to take Part B. So not everybody that I talk to takes Part B when they're first eligible for Medicare. I'm going to talk about that in a little bit. Now, what is Part B? Part B, your card just says medical on there. This is going to be anything medically done to you. Maybe your primary doctor, your specialist, your MRIs, your CT scans, CAT scans, emergency room visit, urgent care, surgery. It could be inpatient surgery or outpatient surgery. So it's everything medically done. Remember, it does not cover your inpatient hospitalization or inpatient rehab. It's just outpatient. Part B is outpatient rehab as well. So like I said, it is optional in some cases. So it's optional because Medicare next year is $185 a month. They just released that information about a month ago. So if you decide you don't want to take Medicare, you could, keyword could, owe a 10% penalty for every 12 months you were eligible for Medicare but did not take it. So let's say I'm somebody who says, I'm not paying $185. I'm going to go ahead and just not sign up for Part B. I'll take Part A. Hey, that's free. If I get hospitalized, they'll help me out. But I don't want any medical coverage. I'm healthy. I don't want it. January 1st, Part B comes and goes. I don't take it. All of a sudden, the next January, I decide, I think I want to sign up for that Part B now. The government's going to say, hey, you went 12 months where you didn't have Part B. Now we're going to charge you a 10% penalty. So if next year in 2026, if Part B is $190, I'm going to pay an extra 10% or an extra $19 a month. And I'll have that 10% penalty for the rest of my life. As it goes up, it will always be 10%. So you'll never get rid of that Part B penalty. Now, here's the second scenario. Let's say I'm turning 65 next month, but my wife, let's say she works, she's a school teacher. She was a school teacher until we had our child, but she was a school teacher. And let's say I was on her insurance and she's still working. I say, well, I don't want to go on Medicare. I want to stay on her insurance. I can do that because here's how it has to be. You have to be on employer coverage that is still active. So it has to be your own active coverage, health coverage from your employer, or your spouse's active employer health coverage with 20 or more employees. So if you say, well, Chaz, I have employer coverage, but we're retired. Nope, you have to have Medicare then, A and B. Or maybe you say, Chaz, I'm working and I have health coverage, but it's from the marketplace. I got it at healthcare.gov or an agent signed me up with it. I got an ACA plan, Affordable Care Act plan. Nope. Once the month you turn 65, so for my case, it would be January 1st, I am no longer eligible for that marketplace plan. I need to go on to Medicare. What if you have VA benefits or TRICARE for life? That is not something where you can delay Part B. You got to go on Part B of Medicare. You get that penalty. So again, as long as you're still working or your spouse is still working and you have active coverage, your employer health insurance from that employer with 20 or more employees. If it's less than 20 employees, then Medicare ends up being primary. You need to take Part B of Medicare. All right. So when can you enroll in Medicare? So you say, Chaz, okay, yeah, I realize I need to enroll in Medicare, or maybe you realize that you need to let Medicare know you don't want Medicare. When do you do that? You can do it 3 months before your month of eligibility. What does that mean? Let's use a different example. Let's say your birth date is August 15th. That means you're going to start Medicare August 1st, right? So 3 months prior to that would be July, June, May. So as of May 1st, you can sign up for Medicare, but it won't start till August 1st because that's your first month of eligibility. Now, let's say you forget to do that. You were just busy. You had a death in the family. Something happened. Well, you still have the month of August because that's your birth month. And you forget again. Well, you got 3 months after. You got September, October, November. If December 1st hits, you're locked out until the next enrollment period. So make sure you do something before then. Don't do anything. Don't do nothing, I should say. Make sure you do something. Always schedule a phone call with me. I can help you either delay Medicare or pick Medicare up. Now, up here, I know on Tuesday somebody was confused. I want to make sure you know this right here, this 185, that is not a gap in Medicare. That's a monthly premium. A premium is what you pay, like your cell phone premium. You have to pay it every month in order to have it. All right. Anything below here is a gap in Medicare, meaning that you're going to owe it. Medicare is not going to cover it, and it's a part of the medical. It's Part B. So it's a gap in Medicare, just like we had Part A over here on the right-hand side. We had gaps in Medicare. So the first thing is the deductible. Now, a deductible is not a premium. I know a lot of people get those kind of mixed up there. A deductible is what do you pay first in a calendar year before Medicare will pay anything. So in my example, where my birth date is in January, I start Medicare January 1st. Let's say I go to the dermatologist. And I know what the dermatologist bills are because I just went 3 times, I think, in the last couple months because I had to get some things removed. They had to go back in deeper, all that fun stuff. And I know even with my insurance, it still cost me $400. That's with my insurance. But under Medicare, they'll say, hey, the first $257 is out of your pocket. Then Medicare says, okay, now they met the deductible for the year, January 1st through December 31st. That's for everybody. Then Medicare says, okay, they met the deductible. Now we're going to pay 80% of the bills and you're going to pay 20%. That's the gap there, the 20%. So let's say the next day after your dermatologist, you just happen to have a cardiologist visit scheduled. And let's say that visit is $200. Well, you've already met your deductible for the year. So now you just pay 20% of $200, which is $40. Not bad. But what if you go to the emergency room and it's a $10,000 bill? Well, now you owe $2,000. What if it's a outpatient surgery? That's $30,000. Well, now you owe $6,000. There's no cap to this 20%. It's infinite. So that's kind of different than insurance that you might have right now where there is a cap on your 10% or 20%. There's no cap on that 20%. And it's when I say Medicare approved charges, that means that Hey, the hospital, we know they're going to put some crazy number out there, $100,000. But once Medicare gets it, they say, no, you accept Medicare. You know that for these procedures, this is what we allow, $10,000. And you pay 20% of the approved amount. Last thing here is very, very uncommon, excess charges. I will tell you right now, you probably, most likely, will never see an excess charge, but I would never say 100%. What an excess charge is let's say your doctor accepts Medicare, or I should say your doctor or facility did not opt out of Medicare. They have to actually opt out if they don't want it. It's not opting in, it's not opting out. But the doctor might say, hey, I did not opt out of Medicare. I accept Medicare, but I don't like what Medicare is willing to pay me for these procedures I'm going to do for you. They're allowed to charge up to a 15% fee above Medicare's approved charges. Facilities can do that. Hospitals can do that. Mayo Clinic up in Jacksonville used to do that. Up until about, I think, 4 or 5 years ago, they stopped charging excess fees. I used to live in Jacksonville. I lived there from 2014 to, I think, 18 or 19. And I remember talking to people saying, hey, if you live here in Jacksonville, be careful of that excess charge. But they stopped doing that. So typically, you don't have to worry about that. You can always go to Medicare.gov, type in your doctor's name, and they'll tell you if they charge the Medicare approved amount or not. Okay. So remember, everything below here, below this line, is your gaps in Medicare. You would owe this. And then remember, your premium up here is most likely $185 a month. Now, why do I say that word most likely? Because unfortunately, not everybody will pay the same premium for Medicare. That's where we go to the next stage here. Okay, so let's look at the left-hand side over here. The standard premium for Part B in 2025 is $185. It could be higher depending on your income. Social Security will tell you what your Medicare premium is going to be the month before you start Medicare. So the premium that you're going to pay is based off your modified adjusted gross income from 2 years ago. Yep. So in 2025, they're looking at everybody's, not just you guys, not because you're new to Medicare. They're looking at everybody's 2025 income. Those letters for my 2025 people that are already on Medicare, they went out this week because I've got about 6 or 7 emails or phone calls from people saying, "Hey, Chaz, why is the government looking at my income for 2023 next year?" Well, they always do that. They always look 2 years back. If you're not collecting Social Security benefits, you're going to be billed quarterly for your Medicare premium, quarterly. So you can set up monthly. If you're collecting Social Security benefits, monthly premiums will come out of your Social Security check. So like I said, the government is going to look at your income in 2025. They're going to look at your 2023 income. This is called IRMA, Income Related Monthly Adjustment Amount. So when the government looks at your income from 2 years ago, and by the way, this moves forward every year. So in 2026, yes, they're going to look at your 2024 income, what you just made this year. 2027, they're going to look at your 2025. So in 2025, they're going to say, hey, did you file an individual tax return and did you make $106,000 or less? If you did, then okay, you're okay. You'll pay the $185 a month. If you were married, filing jointly, and you made $212,000 or less, you're okay. So I don't need to go through all these numbers here. And again, I have the Medicare cost for 2025. I can email you that sheet with all these different numbers on here. But the more you make, the more you're going to pay for Medicare. Now, common questions I get. I just had a phone call with a guy who's starting Medicare in January. He hasn't got his letter yet, but he said, look, in 2023, we made the max. Me and my wife made over $750,000. And you can see there at the bottom, he made more than that in 2023. So his premium is going to be $628. And he said, that's not good. That's not fun. I said, it's not. But aren't you retiring? He goes, oh, yeah, I just retired last week. So a common question I get is, well, now that I'm retiring, my income's going way, way down. Do I still have to pay that high Medicare premium? The answer is no. I told him once he gets that letter, the IRMA letter, they call it, showing what his Medicare premium will be, reach out to me because I'm going to send him a form. And it's a life event change form. This form is going to say, I don't feel I should have to pay that additional amount because and you check off a box. Did you retire? Or maybe loss of income from just working less, or maybe you went part-time, or maybe your spouse passed away. Maybe your wife was making tons and tons of money, and all of a sudden she passed away, and now your income is a lot lower. Well, heck, you can't pay that high premium. So there's different reasons why we can use that life event change form. So Medicare, Social Security will let you know what your premium will be. Also, another thing, I just read an article, and this has happened to me too with my clients, taking inheritance. What was another thing? Taking money out of your 401k. If you take money out of there, one guy, I read an article, he was helping his son to do a down payment. So he took $80,000 out, and it put him into a higher Medicare bracket. You got to be careful there. I had another client, she was going to retire as a school teacher and take her money out of her 401k, and she wanted to pay off a bunch of stuff. Thankfully, she told me about it. I was able to enroll her into an IRA where she's taking a monthly draw to keep her income lower for taxes and for Medicare costs. So definitely be careful there, okay? All right. Third part of Medicare is Part C, Medicare Advantage plans. I'm sure you guys have seen the commercials. Maybe you've been watching TV of hearing a different way to get your Medicare, and that is exactly what it is. It's a different way to get your Medicare. These are completely optional. Some people choose them, some people don't. I'm going to go into the pros and cons a little bit later, but I want to let you know that Part C, it's nothing new. It's been around for 20 years. But what it is you're telling an insurance company, I want to get my Medicare from you. I don't want to get it from the government. Now, you still have to have your Medicare A and B. And if you remember, I just went over Part A hospital and Part B medical, right? Did I talk about dental? Nope. Did I talk about vision? Did I talk about drug coverage? Did I talk about groceries or over the counter? No, because Medicare A and B has been the same as it's been for 59 years now. The cost has gone up, but as far as what they cover has been the same. So in 2000 or so, the insurance companies said to Medicare, hey, why don't you guys pay us and we'll offer their Medicare? And Medicare says, fine, and you guys can offer whatever you want as long as you don't offer less than us. You have to offer at least what we offer or more. So if you get an Advantage plan, you'll most likely have drug coverage included. We haven't talked about Part D yet. Most plans might give you dental, vision, hearing. They might give you an over-the-counter benefit. So it's a different way to get your Medicare. It's not all positives, though. There are some negatives that I'll get into in a little bit. All right, let's talk about the fourth and final part of Medicare. That is your Part D drug coverage. Because like I mentioned, Part A and Part B of Medicare, they don't cover your drugs. Never have, maybe never will. So Part D, it's optional in some cases. Maybe you don't want drug coverage. You tell me, Chaz, I'm healthy. I don't want to get a drug plan. Do I have to? No, you're not forced to. But if you don't get a drug plan and in the future you decide to get one, you might have a 1% penalty for every month you were eligible for drug coverage, aka you turned 65, or the month you turned 65. For every month you were eligible and did not enroll. And that's 1% of the national average premium, which is about $36. You can see premiums start at zero and they go, I think the highest is like 167 or something like that. So anywhere in between there. The average, though, is $36. If you get that penalty will never go away. Now, there are limited exceptions. If you're still working and you have coverage from your employer, or maybe your spouse is still working and you have coverage from his or her employer, you can delay Part D just like with Part B, but there's a different stipulation here. It has to be considered creditable drug coverage. You don't know if it is. I don't know if it is unless you see it in writing. Every year, you should get a package either by email or electronic or in paper, by person, saying if your coverage is at least as good as what Medicare covers, considered creditable. If it is, you can delay Part D, D as in drugs. If you have VA benefits, if you have TRICARE for life, you can delay Part D. You don't have to take it because you have creditable drug coverage from the military. Now, what if you have a marketplace plan that you purchased on your own? Nope, that is not drug coverage. You got to go on Medicare's drug coverage. Oh, and new for 2025, I just added this. I forgot it for Tuesday. That's why I didn't record on Tuesday. Is new for 2025. There's a new 2,000 cap on drugs. There's no more donut hole. A lot of people don't know this, but prior to 2025, I have people that spend, I think I have one guy spends about $8,000 on medications per year. Next year, I put him on a good drug plan. He's going to spend $500. 500. That's his cap max. Now, I know the cap here says $2,000. That's just the most you can spend on covered drugs. That's the basic plan. There are better plans that you could even spend less. So no more donut hole. That's a good thing. All right. So when can you enroll in a drug plan? Same thing. 3 months before your month of eligibility. It won't start till you're eligible, though. The month of and up to 3 months after. If you go 63 days without drug coverage when you are eligible, the penalty will start to accrue unless you have creditable drug coverage, other creditable drug coverage. Okay. You don't need to memorize all this. Talk to me on the phone. I'll explain, make sure that you don't have any kind of penalty. And more important, every year you can change these drug plans. There is no reason to do this by yourself. This morning, I got a phone call from one of my clients for 2 years now. And he said, "Hey, Chaz, how's my drug plan for next year?" And I said, "Thankfully, it's good." He's like, "Well, I got to December 15th, right?" No, December 15th is for healthcare.gov marketplace plans. Medicare's drug annual enrollment, it's not called open enrollment, not yet. They're probably going to change it, but the annual enrollment period is October 15th through December 7th. So I send out 3 emails. Next year, I'm probably going to send a text as well saying, "Hey, everybody, it's that time of year. We got 7 weeks. Click here to schedule a call." That's all they have to do. My clients click a link. They schedule a phone call with me. We talk about their drug plan. Any drug plan changes you make become effective January 1st. And some plans have a deductible. Some do not have a deductible. If you do have a deductible, it could be as high as $590. So definitely make sure you know. There's no reason not to use an agent. You might as well. You don't have to do this on your own. We can never charge you. Hopefully you use me as your agent. You never pay me a dime. I am somebody who helps you find a plan. Whatever plan you pick, that company pays me for help finding you. So it doesn't penalize you at all. All right. So let's say you're turning 65, you go on to Medicare and you say, "Chaz, I guess I need a drug plan. How do I get drug coverage?" Well, there's only 2 ways to get drug coverage through the Medicare system. You can either get one of those Medicare Part C Advantage plans that we're going to talk about in a little bit. Remember Part C? They'll give you drug coverage because they can give you more than what Medicare is giving you. So they're allowed to include drug coverage. But maybe you're one of those people who say, "I don't want a Medicare Advantage plan. I read about them. I don't like having a network. I don't want it." Okay. You can take your Medicare A and B and you can add a standalone drug plan. Standalone means that it just does that. It covers your drugs. It doesn't cover 100%. You're going to have copays, but it does give you drug coverage. So that's the only 2 ways to get drug coverage through the Medicare system. And be careful, again, if you have high income, you're going to pay more for Medicare or drug coverage as well. So remember that IRMA? So be very careful if you're taking money out of a 401k, an IRA that has not been taxed before, or maybe, when the guy was taking money out for his son, or my client that was going to take money out to pay off her bills. You got to be very careful there. The government's going to look 2 years back. I'm not going to go through all these numbers again. Again, I can send you the form or the sheet, that Medicare cost sheet for 2025 that'll have all these numbers, but you can see if you make too much money, they're going to charge you more for drug coverage as well. And like I mentioned before, the national base beneficiary premium is $36.78. That's the base. It doesn't mean it's what you're going to pay. It's just what they charge on there. Again, plans start at $0 per month. Oh, and it is based off of your modified adjusted gross income from 2 years ago. Okay, so we talked about Part A hospitalization, Part B medical, right? Part C Medicare Advantage, Part D drug coverage. There are no more parts of Medicare, but let's go back. Let's think back on the Part A hospitalization and Part B medical. Remember I talked about those gaps in Medicare? It's what you would owe. It was in light blue. And you probably looked at those numbers and said, "Okay, well, shoot, if I'm hospitalized, I'm going to owe $1,676 for that hospital stay. Then I got to pay 20% for the surgery, and it's like, oh my gosh, these numbers are going to add up. Well, maybe you decide you don't want to owe that. You want to transfer that risk to an insurance company. That is completely optional. About 50% of my clients choose a Medigap plan, also known as a Medicare supplement plan. What you are doing is you're telling an insurance company, I'm going to give you X amount of dollars per month, and I want you guys to cover those gaps in Medicare. So the government standardized these plans back in 1990. So before 1990, some companies would cover this or that, and you wouldn't have coverage for this. Maybe it would cover cancer better, or one company would cover this better. So the government wanted to make it easy. The government said, look, we have Part A and Part B. We're the government. We got Part A and Part B. This is what they get. If we approve a procedure, insurance company, you must cover what we approve. So, for instance, I'm sure you guys have heard about the United Healthcare CEO shooting, about United Healthcare denying some claims, so people are upset about it. Well, what if you had a supplement plan, a Medigap plan? You just said, Chaz, that if Medicare approves it, they have to cover it. Yes, the exact same thing. So insurance companies offering Medigap plans have to cover the same benefits from strict federal guidelines. So if the Medicare approves a procedure, a supplement plan, doesn't matter what company you choose, United Healthcare, Blue Cross Blue Shield, they must cover what's approved by Medicare. But the government did give them options. They said, hey, look, we're going to create a chart for you guys. And you can have plans that maybe cover more than another plan, but every company covers the same thing. So where it gets tricky is the government lettered these things. So don't worry about writing this chart down. I'm going to go over it right here. But also remember, when I send you my Medicare, everything they need to know about Medicare booklet, it's going to have this chart listed on here. This is not an insurance company chart. This is a government chart. The government created this chart that insurance companies have to follow. The only thing I hate is that they letter them. So let's start on the left-hand side over here. We see the word benefits, right? And you say, oh my gosh, Chaz, we got to learn all these benefits. No, we don't. You know why? Because we already went over it. We already went over all this. Remember that when I talked about the blood, the first 3 pints of blood? I'm sure you remember that, because it's an odd thing to say first 3 pints of blood. Remember the Part A deductible? That was your $1,676. Remember the Part B deductible? That was the $257. Remember that excess charges that doctors can charge? The only thing we didn't talk about was foreign travel. Medicare does not cover you out of the country. So as you can see on the boxes to the right, some companies will give you coverage out of the country. So the benefits we don't need to go over again, because we already kind of looked at that. But let's look at the plans available. So it's very important that you see this word plans right here. There are only 4 parts of Medicare, Part A, B, C, and D. But there are, I don't know how many plans, there are 11. Now, these are insurance plans. So to put it a different way, back in 2009, when the guy at the office was training me how to do this, he looked at me, went through all this stuff, and he said, Chaz, what is Plan D? What does that cover? So think about it for a second. What does Plan D cover? Well, I immediately thought I was smart and I knew it. And I said, oh, easy. That's drug coverage, D for drugs. That's how I remembered it. D for drugs. And he said, wrong. That is Part D. So remember, Part A, hospital, Part B, medical, Part C, Medicare Advantage, Part D, drug coverage. If you see the word plans, Plan D, because he said Plan D, that's an insurance company covering Parts A and B of Medicare. Okay. Let's go to the far right over here. Let's look at F as in Frank first, and C over here. And you can see right above it, it says Medicare first eligible before 2020 only. The reason why I mention this is because I like to mention Plan F. I used to sell a lot of Plan F. I still have a lot of clients on Plan F. It was the easiest to explain to somebody. I would go back to Part A and Part B of Medicare and said, hey, Nancy, you see all these gaps in Medicare? If you want to pay 0 for all the gaps, choose Plan F. It will cover everything 100%. Very easy. Now, does it cover dental? No, because remember, supplement plans are only allowed to cover what's left over from Part A and Part B of Medicare. So I would tell people, if you want your A and B covered, do Plan F. Now, Plan F, again, is not available for you guys. You won't be able to get Plan F. So what is the new Cadillac plan? The new Cadillac plan is, let me get this out of here, is right here, Plan G. This is available to anybody who is on Medicare. I can't get it. I wish I could. But again, you say, well, how does it work? Well, it covers everything that's left over from Part A and Part B. Let me go back and show you. Remember the Part B on the right-hand side? If you chose, and you tell an insurance company, I'm going to pay you X amount of dollars, what are you guys going to do for me? The insurance company is going to cover this in full. They're going to cover that in full. They're going to cover this in full. And they're going to cover an additional 365 days beyond that. They're also going to cover this in full. So under Part A, you get hospitalized at all, your hospital stay, the nursing, the meals and everything, the supplies, you're going to pay zero. The insurance company is going to cover that. They're hoping you stay healthy and you don't go in, but that's a risk they're willing to take because you're paid a monthly premium. Now, remember, you still got to pay Medicare. That's a premium, $185 a month. This is additional premium. We'll go over that in a little bit. Now, Plan G, Plan F used to cover that deductible, that Part B deductible. Plan G cannot cover this deductible. It's not allowed to. The government stopped that in 2020. But it will cover this 20%, and it will cover any excess charges, and it covers foreign travel in case you're out of the country. So I have a lot of clients who are on Plan G. I just reminded them in October, November, December, hey, Carl, you have Plan G. Just don't forget, in January or whenever you go next for Part B and use it, you're going to have to meet the Medicare deductible. It's not a Plan G deductible. It's a Medicare deductible, which next year is $257. After that, anything approved by Medicare A and B is covered 100%. And again, I stress, the insurance company cannot deny it. They're not allowed to. So if you're worried about, oh, what company is going to deny more? Nope. If Medicare approves it, they have to cover it. Okay. So that's definitely a pro with Medicare supplement plans, is they cannot deny coverage. They have to cover what's left over from Medicare. Now, in Florida, I know you see all these different letters, A, B, D, K, L, M, N. In Florida, the only plans you're going to see is Plan G, Plan N is a good option, or a high deductible G. That's why you see G1 up top. A high deductible, I'm not going to get into very deeply here, but it's for somebody who wants to pay less per month. And instead of a $257 deductible, next year they would have a $2,870 deductible. But their premiums are like a third of the cost. So everybody's different. Okay. Remember, if you ask me, hey, Chaz, does that supplement plan cover drugs? Nope, they're not allowed to. Does it cover dental or vision? Nope, they're not allowed to. Now, when I mean vision, I mean glasses. They can cover, conditions of the eye, but not preventive stuff. Okay, so let's talk about your options. You might be somebody who is still working and say, Chaz, I don't need to know my options because I'm not going to retire for another 5 years. That is fine, but I still want you to kind of get an idea here of which way you think you're looking, because eventually you're going to go on to Medicare and you might need to make one of these options. And then hopefully you schedule a phone call with me in a week or a month and you say, Chaz, hopefully not farther than a month, because at that point you might forget which way you were looking. But here's what I do with everybody. You schedule a call with me and I say, okay, your birth date's in August. I'm going to put you in my calendar right now to reach out to you in May. And in May, we're either picking up Medicare or delaying Medicare or whatever your month is. I will help you out with that. Then I say, hey, you remember my webinar last week? Do you think you were looking at that supplement plan, Medigap plan, or were you looking at the Medicare Advantage plans? And I put that in my notes, because in 3 or 4 years, if you retire, I say, look, things might have changed now, but let me let you know that a few years ago, you were looking at Medigap plans, so whatever, so make sure you kind of get an idea of which way you think you fall on. By the way, I did both of these. I did all of this for my parents as well. My dad's been on Medicare for almost 7 years now, and they did choose option 3. They chose a Medicare Advantage plan, but it doesn't mean it's the best. Maybe it's not right for you. If it were me, I would be on a Medigap plan, okay? So you're going to have your Medicare A and B. You can either add a Medigap plan to it and add drug coverage. If you want dental and vision, that is separate. Or you can choose a Medicare Advantage plan, which includes your drug coverage. So on the next slide, I'm going to compare Medigap versus Medicare Advantage. I'm going to give you some pros and cons of each one. And then we're going to talk, again, I can't give you exact prices because everybody's in different areas, but I can give you an estimate of what it might cost you out of pocket when you do go on to Medicare. So let's compare benefits differences. All right. Left-hand side is saying that you have Medicare as your primary, and then you choose that Medigap plan. Hey, Chaz, I like that plan G. You said it was very comprehensive. First thing, which is definitely the biggest positives out there, is that you have no network. You can go to any doctor, any hospital in the USA that accepts Medicare. So I don't care what insurance, what supplement company you have, doesn't matter what company it is, you have no network. It's very easy. Hey, doc, do you take Medicare? It's not that common that you see somebody that doesn't take Medicare, but I will say it seems to be kind of common in chiropractors. I talk to my chiropractor and I go, why don't you take Medicare? He goes, I don't take any insurance. He goes, insurance, whether you're 20 years old, 65 years old, doesn't matter to me. I don't want to take it because the insurance companies and Medicare they don't look as chiropractors as I guess real doctors. That's what he told me. He said they're thinking I'm not a real doctor. He said they barely pay him anything, pennies. So my guy is cash only. And I've heard that from a few chiropractors that Medicare typically doesn't take them, but I'm sure you can find chiropractors that do. Otherwise, any doctor, any hospital nationwide that takes Medicare, no network, you're going to have no copays. Once you meet your deductible, remember it's a calendar year deductible. Next year is $257. You're covered 100%. These are all positives. No other out-of-pocket costs. Once you meet that deductible, anything approved by Medicare A and B is covered 100%. Well, some of the negatives are they're not allowed to cover anything outside of Part A and Part B. They can't cover your drugs. They can't cover your dental. You got to get that all separately. The biggest negative of why doesn't everybody choose a Medigap plan? Because they would if it was free. The biggest negative is it has a monthly premium. They can't do it for free. They're not getting any money from the government. The only premium the insurance company is getting is from you. People choose these because they want freedom to go wherever they want to go. They don't want to have to worry about losing their doctor, or maybe this hospital is not going to take my plan anymore. They don't have to worry about that. No referrals, no copays, no prior authorizations. That's another thing to really think about is positive is you don't have to get approval from an insurance company, aka what you're hearing on TV about United Healthcare, which, by the way, United Healthcare is not any worse that I know of than any other insurance company. But if you have Medicare and a supplement, there's no prior authorizations. There's no denials that way. So very easy. When you are new to Medicare, you can get this Medigap plan, no health questions asked. So either you're turning 65, you're guaranteed approval, or you start Part B of Medicare because maybe you delayed it because you were working. No health questions. They have to take you. They have to cover all pre-existing conditions, and they cannot rate you up. Once you're not new to Medicare, so 6 months later, they do not have to accept you. I had a lady denied 2 months ago. She said she was healthy, everything. She applied. They denied her. She's, 68. She's been on Medicare for a while. They did not take her, so she has to stay on her Advantage plan. So the other option, let me mention one more thing. I like to say this. If you choose Medicare plus a Medigap plan, you're somebody who wants to pay more upfront, that doesn't have to worry about a network, that doesn't want to have to worry about what is this hospital stay going to cost me? What is this surgery going to cost me? You'd rather pay more money upfront to pay less on the back end when you need it, okay? Now, Medicare Advantage, a great option as well, is going to be almost opposite on everything. These plans do have a network. Now, I remember my mom, she rolled her eyes and said, oh, a network? I hate a network. And I said, Mom, right now, you're not on Medicare. If you're not on Medicare, you have a network. There is a network. I have Florida Blue. It's a PPO. It doesn't mean I don't have a network. I still have a network. I changed to a different PPO this past year, and my dermatologist that I've had forever says, we don't accept that anymore. And I'm like, well, what about out of network? Nope, we won't bill it at all. So now I have to bill it myself. Now I can go there, but it's still a network. I still have to pay everything myself and then get reimbursed pennies, for going out of network. So PPOs do let you go out of network. That's a positive. If you're somebody who says, I want to be able to go in or out of network, PPOs. If you, You don't really need to have a lot of doctors. You just want to, you're okay with staying in network and you're okay getting referrals. HMOs could be good for you. My mom said, absolutely no HMO. And guess what she's on today? She's on an HMO because HMOs give you lower copays, better benefits. She saw the PPOs and said, I don't like those copays. Well, do you want freedom of the PPO or do you want lower copays? Every plan has copays. Now, most plans, if not all, will charge you zero for a primary care doctor under a Medicare Advantage, but your specialists are going to be, 10, 20, 30, $40 for a copay. Emergency room might be 120, 130. Every company's different. And you're going to have a copay per day while you're hospitalized. A positive is no deductible. I have a $5,000 deductible before I get coverage, really. Under these plans, you got coverage from day one. You just have copays for whatever you're getting. Oh, you got an MRI? Okay, there's $100. You pay the copay. Every plan has an out-of-pocket maximum. That's a good thing. Mine's $7,500. I have a PPO. Under Medicare, HMOs are going to be around $3,000. PPOs are going to be more like $5,000. It's the most you can spend in a year. And guess what? Another positive is drug coverage is included. You don't have to buy a drug plan. It comes with some dental, some vision, some hearing. Maybe they give you an over-the-counter benefit. Some companies even give groceries. I don't typically try to do those, but if they give you a grocery benefit, more the better. You're giving up something when you gain something, though. Remember that. These plans, Advantage plans, are somebody like my parents who said, we want to spend less money up front. I don't want that monthly premium, Chaz, and I don't mind having a network. I'll find doctors that take the plan. I don't mind having copays. And they haven't spent a ton. I mean, they've been pretty healthy. They've had doctor visits and stuff and, emergency room visit or urgent care, but they haven't had, cancer or anything, thankfully, knock on wood. But they haven't had to spend like thousands of dollars per year or anything, which you might hear about people saying that online. Not in Florida. Florida, that's not going to happen. Okay, so remember, Advantage plans, you want to spend less up front. You don't mind the copays on the back end. All right, so let's compare cost difference, Medicare plus Medigap versus Medicare Advantage. Oh, by the way, Medicare Advantage plans never have health questions. They have to take you automatically. Never any health questions. They can't deny you or anything, rate you up. So if you do Medicare plus a Medigap, Medicare Part A is $0. We know that Part B is typically $185 a month. Medigap plans start at roughly $180. Depends on where you live. Depends if you're male or female, smoker or non-smoker, and your age. What I've listed here is probably a turning 65 female non-smoker in Central Florida. That's kind of an average price there. Drug coverage starts at $0. So you can easily spend $365 or more. Maybe your supplement plan is $200. Maybe your drug plan is $20, so it could be higher. When I showed my parents that, they said, you're crazy because this is per person. There was no way they were going to spend $700 and something because they're used to spending like $50 a month for their ACA plan. On the flip side, there are people I talk to that are, husband and wife spending $2,000 a month on health coverage, and it still has a $2,500 deductible. This is a bargain, and they get great coverage and no network. They love it. So everybody's different. If that's too much for you, say, Chaz, there's no way I can spend $300 something a month. Well, that's where Medicare Advantage plans have their part. You're going to pay $0 for Part A. We know that Part B is $185. Look at this. The Advantage plans, they don't charge you to be on them. How do they make their money? Remember I said over here, the supplement plans, they don't get any money from the government. Advantage plans are being subsidized from the government. They're getting paid every month for you to be on that plan. That's why you see these commercials. They're fighting for you. They want you to go to their plan. And people always say to me, well, Chaz, you didn't tell me how much this plan costs. I go, I did. Remember, it's a $0 premium. They don't charge you. You still got to be on Medicare, $95. Some people choose a plan with a Part B premium reduction. Now, you got to remember, every insurance company is getting roughly the same amount of money subsidized from the government. If they're willing to lower your $185 right here, or you might hear on TV, get money back in your Social Security check, if you get that money back, you're giving up something else. Either you're going to have higher copays in the plan, or maybe less doctors, or a combination of the two. If that's something that interests you, make sure you let me know. Say, Chaz, I can't afford that $185. we can definitely find a plan. But again, you're going to give up something else. You're going to give up to gain something. You're going to give up something else. And drug coverage is included. Don't forget, you're going to have copays, though. So everybody is different. Get an idea of where you think you might fall on personally. Write that down. And when we talk on the phone, I'll say, hey, it looks like you were looking at this. I put it in my notes. And then in the future, we can always go back on that and revisit it. Okay, we're on the home stretch now. I know I'm running a little slower today, but initial enrollment period, that's what you guys are coming up to right now. This is when you can enroll in Medicare, delay Medicare. Make sure you schedule a phone call with me. When you exit this webinar, a survey will pop up. You'll get a link. I'll send you a link where you can see my calendar, schedule. You click it yourself and schedule a time on there that works for you. I will help you pick up Medicare or delay Medicare. And then every year, I help you make sure you're on the right plan. Hopefully, we got you a good plan that sticks. But if not, we got October 15th to December 7th to change your Medicare Advantage plan or your drug plan. Special enrollment period. I got one right now. If somebody were to call me and say, hey, Chaz, I missed the enrollment period, December 7th. Am I stuck? I'd say, nah, not really, because we had Hurricane Milton here in Florida. The government created a special enrollment period where I could actually move you still. So any time of the year. But that doesn't always happen. Starting next year, I think they're really going to, they said the government wants to crack down on these special enrollment periods. The current administration said that. So that might change next year where I can't just move somebody anytime. And then we got January 1st through March 31st, where you can change your Medicare Advantage plan with prescription drug coverage to another one. You can't change your drug plan, though. Only Medicare Advantage. So Medicare Advantage has two different times. Now, in the future, they're probably going to change this AEP to the open enrollment period. And then the open enrollment period, they're probably going to change that to open enrollment period for Medicare Advantage, which to me is a little better. All right, when should you enroll in Medicare? This is what I said I was going to help you out with. When do you do this stuff? Well, first ask, are you still working or is your spouse still working? And do you have coverage, 20 or more employees, from that employer? If you do, you can stay with that employer insurance. I will help you do that. No reason to do it on your own. I will help you. I will help you delay enrollment in Part B, and then I will help you in the future to get Part B back to make sure you have no penalties and no loss of options. Maybe you want that Medigap plan. Maybe you do have coverage from your employer, but maybe it's not any good. Sometimes I'll talk to people and say, oh, I'm paying $500 a month for my insurance, and it's a high deductible plan. Oh, we're going to be better off on Medicare. I can help you. They have to let you off, and I can help you enroll in Medicare A and B and choose a Medigap plan or a Medicare Advantage plan. All right. If you're collecting Social Security benefits, remember I mentioned earlier that the premium is going to come out of your Social Security check. Not only that, you're going to automatically be enrolled in Medicare A and B. You don't have to do anything. When you schedule that phone call with me, I will call you the exact week that your Medicare card will be in the mail. I'll let you know. Now, maybe you get your Medicare card and you say, Chaz, I don't want Medicare. I wanted to delay it because I have group insurance. Well, I can help you delay Medicare. Or maybe you get that Medicare card and you say, Chaz, I have a retiree plan from the FEHB, Federal Employee Health Benefits. Well, that will go with Medicare. Or maybe you don't have that and you choose a Medigap plan or Medicare Advantage. For the rest of you that are not collecting Social Security benefits, your enrollment into Medicare is not automatic. You do not, I repeat, you do not want to do nothing. Do not want to do nothing. You want to do something. You're either going to let the government know that you don't want Part B. When you tell them you don't want Part B, you're automatically going to get A. You might as well have A, right? Because A was free. So, hey, take it. Now, you cannot contribute to an HSA anymore. If you do that, stop contributing to your HSA the month you turn 65. You get your Part A. I'll remind you that if somebody is going to delay Medicare, I make sure I put in my notes. I told them not to contribute to the HSA anymore. So I'll remind you on that. Now, maybe you're not collecting Social Security benefits, but you need to enroll in Medicare. I can show you how to enroll in Medicare A and B, and you can choose an optional Medigap or Medicare Advantage plan. How do you enroll? You can call Social Security. If you want to call them, if that's the way you like to do it, give them a call. They will schedule an appointment to call you back. Hopefully you answer. I recommend enrolling online. You have to have a Social Security account set up. Just because you set up an account on Social Security's website does not mean you have to take Social Security. Enrolling into Medicare is done through Social Security. If you go to Medicare.gov and click the Enroll Medicare button, it's going to take you to Social Security. So have an account set up on Social Security's account. Schedule an appointment with me. I will help you with enrolling or delaying Medicare. So what you can do today, if you get some time, head on over to ssa.gov. That's Social Security Administration.gov. I already have an account set up. You can have it. Doesn't matter how old you are. It doesn't mean you're collecting Social Security. Click that sign in button up top there, top right. When you click that, it's going to bring up this left-hand side over here. You're going to see a sign in with login.gov, sign in with Social Security. Well, you can't do this. That's bottom gone now. But first you need to click that create an account, because if you don't have an account yet, you got to create one. Then on step 3, it takes you over here. You click the create an account again. You're going to put in your email address, and they're going to send you an email. Then you're going to prove your identity, create a password, all that good stuff. And the next time you go to log in, you're going to use that login.gov button. So do that today if you can. Have that account set up, because no matter what, we're either delaying Medicare or enrolling in Medicare. That's going to be done on ssa.gov. Now, Medicare supplement plans, we got 26 carriers or Medigap plans. I like to call it Medigap plans. Easier to say, and it covers the gaps of Medicare. There are 26 carriers. I'm talking Aetna, Florida Blue, which is Blue Cross Blue Shield, United Healthcare, Cigna, Mutual of Omaha, all these different companies. People always ask me, who do you recommend going with? Well, I typically recommend sticking with one of the 6 big carriers. You want a big company because you don't want them changing hands all the time to a different company, like my mortgage. But you want a company with low premiums. There's a company that might be $180, and the same plan might be $250. There's no reason to spend that high premiums. The coverage is exactly the same. It might not always be the cheapest company to go with, because it might be a no-name company, but you want to stick in the upper bracket of lower premiums. And I'm an independent contractor. I work with everybody. Drug plans, unfortunately, we went from 23 drug plans down to 14. A lot of companies got scared next year because of that new $2,000 cap in I want to say next year, because 2025, there's 14 drug plans. How do you know which one to choose? You send me your medications. I put it into my system, and I say, hey, based off your drugs, here's where you're going to spend the least amount of money. It doesn't matter with me what drug plan you go with. I'm just trying to save you the most money. That's all I'm here to do. Advantage plans. It's not about saving you the most money all the time, because Advantage plans, it might be who has all your doctors. You send me a list of your doctors and medications, and I kind of can narrow it down to where you want to go, whether you're open to HMOs or maybe you want a PPO. So it's not always about saving the most money, because it might be about keeping your doctors. It might be about having the better dental. Everything's different here. But I do take your medications and your doctors, and I can narrow it down to a few different plans. Like I said before, I'm an independent broker. You never pay me anything. I work with all the big companies and some even smaller companies, like Ultimate is tiny, but I like to pick up companies, so I have that options. But I do stick to kind of the big companies. If you're in Brevard County, you probably heard of Health First. I got that one. AARP is really United Healthcare. Blue Cross, which is Florida Blue. Care Plus, Freedom, all these different companies out there. All right, so what I recommend is scheduling a call with me. Don't leave just right yet. I'm going to put out a little slide. This is optional. If you want to click on it now, you can. You're going to see that don't wait, book our one-on-one time with me. You click that link right there. Now, if you're watching this on YouTube, you cannot click that link. I will put this at the bottom in the description, my link where you can schedule a call. But if you're here live right now, you can click that link. You'll see my calendar pop up. Once my calendar pops up, you pick a day and time that works for you. Now, please don't do Christmas week yet, because I haven't blocked that off yet. I need to block off Christmas week there. But otherwise, pick any day and time that works for you. You put your name in, your email, and your phone number, and you'll have that scheduled right in there. I will call you at that time. I'm not here to pressure you into buying anything. What I'm doing is getting an idea of what you're looking to do. Do you want to pick up Medicare? Do you want to delay Medicare? You might say, well, Chaz, my birth date's not till next October. That's fine. Still schedule that phone call because I want to get you in my calendar when I'm going to reach out in the future, 3 months before, and make sure I call you to remind you about Medicare, what to do, and what we were looking at. So definitely schedule that call. Click that link there. You got my phone number there. You can call me anytime, text me. What else? That Medicare booklet I mentioned, my Medicare, everything they need to know about Medicare. If you fill out my little survey that you're going to see when I hit end here, a survey will pop up and you can fill out that survey and you can check the box that says I want the Medicare booklet. Again, if you're on YouTube watching this later on, you won't have that link, but just email me. I can send you that Medicare booklet and the Medicare costs as well. You guys didn't have any questions the whole time, which, I mean, makes it easier for me, but maybe I explained it a little better today. I think go a little longer, try to make sure you guys understand. Any questions, though, feel free to reach out to me, and I appreciate you guys coming out today, and I hope to talk to each one of you very soon. Bye. Thank you. Don't forget the survey. It's going to pop up. It takes a few seconds to pop up.